Why does my back hurt? What should I do?
Most back pain is harmless, but there's a small window of cases where it's the body sending a signal that shouldn't be ignored, and most people can't tell the difference until it's too late to catch. Early, that's the uncomfortable truth. The vast majority of back pain is what doctors call nonspecific. Muscular, mechanical, temporary. It responds to rest, movement, and time. But a small percentage of cases are different. They're the body's way of flagging something that needs a closer look. The problem is from the inside, both kinds of pain can feel remarkably similar at first. By the end of this, you'll know exactly which 7 signs separate ordinary back pain from something that deserves a doctor's attention, and why catching them early actually matters. Let's start with the one that catches people off guard the most: a fall, a car accident. A heavy impact followed by back pain that shows up immediately, or within a day or two. Here's where most people get surprised. Even when the pain feels manageable, trauma-related, back pain deserves evaluation because forces strong enough to cause discomfort can sometimes also affect bone or nerve structures that aren't visible or obvious from the outside. This doesn't mean every minor bump requires an ER visit. It means significant trauma followed by new back pain is a combination worth taking seriously, not waiting out. But that's only the first sign. The next one involves a symptom that shows up somewhere you wouldn't expect. Ordinary muscular back pain typically stays local in the back itself, but when pain starts traveling down one or both legs accompanied by numbness, tingling, or noticeable weakness, that's a different pattern entirely. This often points toward nerve involvement, where a structure in the spine is pressing against or irritating a nerve root. The location of the sensation can actually help identify where along the nerve pathway the irritation is occurring. What doctors often explain next is even more interesting. The specific pattern of numbness or weakness can help pinpoint exactly which nerve is involved, which is why describing your symptoms precisely to a doctor matters so much. This is one of the rarest signs on this list, and also one of the most important to recognize immediately. When back pain is accompanied by new difficulty controlling the bladder or bowels, or numbness in the groin or inner thigh area, it can indicate pressure on the nerves at the base of the spinal cord. This combination of symptoms is considered a medical emergency, not something to monitor overnight. This isn't meant to cause alarm for everyday back pain. This specific combination is rare, but when it happens, timing matters enormously for outcomes, which is exactly why it's included. Here, there's one important detail almost everyone misses about the next sign, and it's easy to dismiss as unrelated. Back pain on its own, even when persistent, is rarely a cause for alarm. But back pain that shows up alongside noticeable unintentional weight loss is a different combination, one that doctors take seriously, specifically because it's unusual. This pairing doesn't mean something serious is definitely happening. Most causes of unexplained weight loss have nothing to do with the spine at all. But because this particular combination is uncommon for ordinary muscular back pain, it's one doctor specifically ask about during an evaluation. But before moving to the next sign, here's a pattern that's easy to overlook simply because it develops slowly. Most mechanical back pain has a rhythm to it. It gets better with rest, worse with certain movements, and eases when lying down a certain way. That variability is actually a reassuring sign. Pain that stays exactly the same, regardless of position, activity, or rest, especially pain that's worse at night and doesn't ease with lying down, follows a different, less common pattern that's worth having evaluated. The real reason this matters is that ordinary muscular pain almost always responds to some change in position. When nothing changes it, that's useful diagnostic information in itself. A fever paired with back pain is a combination that's easy to dismiss as just being sick. But when these two symptoms occur together, it can occasionally indicate an infection involving the spine or surrounding structures. This is uncommon, but the combination is specific enough that it's worth mentioning to a doctor rather than assuming it's coincidental, particularly if the fever isn't explained by an obvious cold or flu. Stay with this because the final sign connects almost everything discussed so far. Occasional stiffness or mild weakness after activity is common and usually resolves with rest. but weakness that steadily worsens over days, especially if it starts affecting balance walking, or the ability to grip or lift, follows a pattern doctors take seriously. This progressive quality is the key detail. A single bad day of stiffness is very different from a trend that keeps declining day after day. The direction of change matters as much as the symptom itself. So here's how they connect. Trauma-related pain flags possible structural involvement. Leg symptoms point toward the nerves. Loss of bladder or bowel control signals an emergency. Unexplained weight loss raises a different kind of concern. Constant unchanging pain breaks the usual pattern of mechanical pain. Fever suggests a possible infection. And progressive weakness shows a trend worth interrupting early. None of these signs mean panic is the right response. What they mean is that back pain isn't always just back pain. And knowing the difference is what allows the right cases to get the right care quickly. For contrast, it's worth remembering what typical, non-specific back pain tends to look like. It's local. It varies with movement and position. It gradually improves over days to weeks. And it doesn't come with any of the 7 signs above. That kind of pain, while uncomfortable, is common and usually responds well to gentle movement, time, and simple self-care, which is genuinely reassuring for the vast majority of people. Watching this, 7 signs, each one a different signal worth recognizing, not to create fear, but to replace uncertainty with clarity. Now you know exactly what separates ordinary back pain from something that deserves a closer look. If this helped you understand your own body a little better, there's more like this waiting for you. This channel breaks down the science behind everyday health questions clearly, honestly, and without the fear-mongering. Subscribe so the next explanation finds you before the next question does.